At the North Carolina Department of Health and Human Services, we are working hard to flatten the second curve of COVID-19, the behavioral health effects of the disease. That means acting now to ensure North Carolinians receive the behavioral health services or intellectual and developmental disability supports they need. It also means recognizing the unprecedented impact this pandemic is having on mental health and ensuring our system is prepared to respond for the long haul. Behavioral health is essential to health, and individuals living with disabilities deserve a response to this disease that assures their dignity, safety, and independence. Here's what we've done. First, we have made significant policy changes. Over the past several weeks, we have changed numerous service definitions, regulations, and policies to give providers appropriate flexibility to ensure care continues. We have issued public health guidance specific to behavioral health and IDD consumers and providers so that everyone has the information they need to stay safe. And we are committed to communicating clearly, which is why we're having weekly calls with consumers and providers, answering questions and addressing concerns. I want to applaud the private insurers that have stepped up to provide access to behavioral health services over the phone and by video and are paying for it at rates on par with in-office physical health visits. I am also grateful to providers that have quickly adjusted the way they work to ensure individuals they serve are cared for. As we look ahead, I know insurance companies and providers will need to continue working together to ensure they can meet the long-term increased need we'll see from COVID-19. This is truly a team effort, and I'm glad everyone is rising to the challenges of this moment. Second, we are working to obtain adequate funding. We recently were awarded a grant from the Federal Substance Abuse and Mental Health Services Administration for $2 million. Just last week, we were invited to apply for FEMA's crisis counseling program. Our team worked very hard to submit our application the same day we became eligible. These funds will grow our Hope for NC program, which will help people in our state normalize their experience, get connected to resources, and build resiliency. This funding is just a start, but we'll take every penny we can get and ensure that we get the most out of it. I'm grateful to my team, who have been working around the clock to make these policy adjustments and to secure funding. They are incredibly dedicated to serving North Carolina. And while much has been done, we still have more to do. Even before the pandemic, the behavioral health and IDD safety net was stretched. With 12,000 individuals on the Registry of Unmet Need and 1 million people without health insurance, the resources don't match the need. The COVID-19 response funding passed by the General Assembly is an important first step for the near-term needs, and we deeply appreciate their support of behavioral health. But we still need broader reforms. We must continue to push for systemic change, and that means providers that practice whole-person care and treat the mind and the body as one. It means changing our systems, justice, economic, educational, and social, to support and sustain recovery instead of pushing people to the fringe. And it means everyone has access to prevention and care that works in partnership with patients and their families. This is a bold vision, but now more than ever, we know we must continue pushing toward it. As you know, Governor Cooper, with the support of Secretary Cohen and our team at DHHS, announced a strategy for easing restrictions while staying ahead of the curve, which built on testing, tracing, and trends. This plan is a phased approach that is cautious, carefully considered, and driven by science and data. We will be able to understand what does and doesn't work and make changes as needed to help us all stay safe along the way. What this means for the behavioral health and IDD system is adjusting to modified operations for a sustained period of time. We are committed to addressing our state's behavioral health and IDD needs consistently, equitably, and by providing supports that are effective for everyone. Our challenges are great: policies, funding, and achieving our bold vision for the road ahead. But I know when we are united, we are equal to the task. These are important times and our choices matter. I am grateful for your help and your partnership and your feedback. Thank you for standing with us as we do this work together.